All right, welcome to the Ike STeeLE Show. This is a beautiful, beautiful, beautiful studio we've got here, and this is one of our first shows since we moved to the studio, and I'm very highly honored to have a clinical psychologist here on the Ike STeeLE Show, Dr. Roger Girion. Roger Girion is a very qualified individual to talk about the topics that we have today. And today we're tackling three topics. One is sexual therapy, PTSD, number two, and addiction. And you'll be amazed, the kind of things that this very intelligent individual the light is gonna shed on these topics. So Dr. Roger, please introduce yourself to our audience.
Well, thank you for having me here. I'm a licensed clinical psychologist here in California and board certified in California, and I also am a fellow of the American Board of Psychotherapy. I am current clinical director for the Psychiatric Emergency Services at Antelope Valley Hospital, and clinical director for my own clinic, Antelope Valley Mental Health Professionals in Lancaster.
Amazing, amazing, amazing. So definitely, let's jump right into it. Sex therapy.
Yes.
What that topic, when I saw that topic as one of the things that you tackle, the things you talk about, I got so interested because I just assumed that all adults involved in sex, why should we be doing any form of therapy when it comes to sex? Can you enlighten me further?
Yeah, well, first of all, it's intriguing to me that we don't have a lot of classes in school on love or on sex.
Wow.
Health, some people have health in high school, and there's a very limited, almost mechanical description of sex in health classes, and it's really centered on how do you avoid diseases, how do you avoid pregnancy, and so on. But sex
You're
is
the one who's teaching classes.
correct.
Okay.
It's fascinating. Years ago, there's a guy named Leo Buscaglia who actually taught a class on love at USC, and he started off with a classroom of 34 seats.
Okay.
On day one, 642 students showed up. He goes, I think we need a bigger boat. I think we need a bigger classroom. Right. So they taught that class in the auditorium. And it gives you an idea of how hungry people are to understand what is love. We don't have classes on what is love. There's poetry about love. We see romantic movies about love. But not a lot of people are actually taught much about love. We assume that our families teach us about love, but that's not necessarily true.
Right.
A lot of times we have absentee parents, latchkey kids, and so people are hungry to understand what love is.
Right.
And sex is one language of love. It's not the only language of love, but it is a language of love, to be sure.
But correct me if I'm wrong. I thought sex is the predominant language of love, no?
Not necessarily, no, not at all. In fact, the most powerful sexual organ in our body is our brains. So it's easy to get turned on. It's real easy to get turned on. And adolescents, are turned on just by the slightest sexual innuendo in a movie, or males are visually turned on. Women are more emotionally turned on.
True, yeah.
So, but sex is not the same thing as love.
True, yeah, okay.
You can have sex with somebody and not love them at all.
True.
You could love somebody and not have that be a sexual love. There's all kinds of love. There's agape love, as they say, where you care about your fellow human being.
Yeah, right. The God kind of love. Okay.
Right. And then there's patriotic love. You have love your country.
Oh, true.
And then there's sexual love, which is or romantic love, which is much different.
Right. We have a guest in our midst. Okay, we have a little one. All right, you step back. All right, good. Well, you mentioned something. You said something about men and women, the way we love.
Yes.
Women are more emotional, and men are more
They're
physical.
They're physical and more visually oriented in terms of getting turned on.
But you know, these days, most modern women now say that they are not as emotional as they've always been classified. I guess the liberated women, that they can have sex without being attached emotionally.
Yes, this is true. This is true. This was an outgrowth of once we had birth control and education in terms of protection against venereal diseases. Women are more free to express themselves sexually, as are men. And that leads to a sense of equality between men and women.
Well, I still think women are more emotional than men. Some of my girlfriends will argue that that's not true, that this is 50-50. But I just think...
Well, that's because there's a power negotiation in relationships. And some women are equally into power as men are. And that hasn't always been true historically or hysterically.
Okay, well, still on the subject of sex therapy, now, would you say that women always climax during sex? Is that an issue that you've seen in your line of work?
Well, it is not always true that women do not always climax, and it's not always a disorder. Some women just don't want to give themselves over to a man, for example. So that's part of that power negotiation.
Wow. Okay. Maybe this is a little bit deviation from the topic, but would you say that's the reason why some women don't kiss? Because they feel like when they kiss, they're emotionally connecting to a man.
I think that's quite possible, yeah.
Or to be exact, you say most prostitutes, when they have clients, they don't kiss. It's part of, and not to say that I patronize that industry, but this is what I've been told.
Yes, that is true, and it's part of not wanting to get any respiratory problems while they're with their clients. Yes.
Respiratory problems. Okay. All right. So, what other things you want to enlighten us about sex therapy?
Well, sex therapy is a lot of times, very often, having to do with inhibition of some sort. That the human sexual response is inhibited. First of all, we're born naturally, organismically responsive to life. All of us have sexual urges.
Right.
Somehow they're bludgeoned out of us sometimes because of inhibition, either societal inhibition or parental inhibition, or inhibition because someone has experienced some trauma sexually. Or it could also be because someone doesn't have a healthy relationship with themselves.
Wow.
Every relationship we have flows through our relationship with ourselves.
True.
So if you don't have a healthy relationship with yourself, it's going to affect...
Exactly.
Correct. And that's what therapy in general is based on, let alone sex therapy. It's based on the idea that you strengthen your relationship with yourself. And sex therapy specifically has to do with your exploring your relationship physically with yourself and emotionally with yourself and with others. Feeling comfortable in your own sack of skin.
Right, right. Okay. Now, would you say, is there anything like sexual, like someone is an addict sexually because they want sex all the time? Or is that a problem?
Well, it might be to the person. Anytime you can't tell the difference between wanting something and needing something, you have a psychological addiction. When someone has any addiction and it interferes with your functioning generally, your social functioning or your work functioning, or your relationship with yourself again, that's a problem. sexual addiction, almost any addiction, can become a problem.
Well, you know why I asked you this question? I used to date a girl a long time ago, back when I was in Houston, Texas. And she made me feel like I had a sexual addiction, that I wanted sex because I wanted sex more than she gave or she offered. So for the life of me, all this time growing up, I always thought I had a sexual problem. She kept saying that I needed to go see a doctor or a psychologist to cure my sexual need. So, but when I came to California, I met the sweetheart I was dating back then. I felt like I couldn't meet her sexual needs because I was not sexual enough. So, I mean, so you see, one person made me feel a certain way. Another person made me feel that I'm not able to
the opposite.
Exactly. So, what do you think about, do you see patients like this or things like this in life? Or?
Yes, I see that in terms of a couple ways. Number one, the person who loves the least in a relationship holds the power. So when one person loves or is attracted less to the other person, they hold the power. That's one thing. So if you're in a relationship with someone and you want them more than they want you, they hold power over you. If they're into power. They may not want it, but they have it.
You're talking about if you want somebody. What if you're finally dating, or if you're married? If you're married now, well, is that the same theory applies?
Those negotiations, power negotiations in relationships occur all the time.
So it fluctuates.
Yes, and it waxes and wanes in relationships. There was a great novel by a guy named Tim Robbins called Still Life of a Woodpecker. And it's a funny book, a funny name for a book that the guy says, Tim Robbins, who wrote the book, said, the greatest challenge of the 21st century man will be how do you make love stay? Because everything in our society is instant. We have a microwave type of society. So we want instant intimacy, instant sex, instant, microwave dinners, and
instant love, instant marriage, instant divorce, instant everything.
Intriguingly, it takes a lot of time to get to know somebody.
True.
And if you really want sexual fulfillment, get to know them. Get to know them physically, negotiate your needs with them. That's a powerful concept, but we want everything instantly. There's always certain things in society that are going to take a certain amount of time. For example, it takes 9 months to deliver a baby. You try to rush that and you're going to have a problem. It takes a certain amount of time to digest a meal. You try to rush that, you're going to get indigestion. And in fact, our society is, we sell more drugs for indigestion, GERD, gastrointestinal problems, because we try to rush when we eat. And then a lot of sexual disorders occur when somebody tries to rush physical closeness.
Wow. Could that also be a reason why most people have problems in relationships, because they're just trying to rush and not let things evolve? Or?
Exactly. Yeah.
Wow. Well, all right, when we come back, we'll talk about PTSD.